Hey, I'm generally not political. I'm apolitical. I don't lean left. I don't lean right. You might consider myself in the middle, I suppose. I try not to participate in politics. I think it's generally a circus. Um, so I generally formulate my own opinions and go based off of that and don't participate in politics. But this particular situation is about the assassination of Brian Thompson by Luigi Mangione. And it's important to me for a variety of reasons. I only have 9 minutes to squeeze this in, so I'm going to talk pretty fast. Um, let's go into the background of Brian Thompson first. He became manager at PwC, a professional services network, in 1997. He then moved to becoming the CEO of United Healthcare in 2021. His tenure as CEO was marked by rocketing profits as medical care became increasingly denied. In 2021, the American Hospital Association criticized Thompson for planning to deny insurance payment for non-critical visits to hospital emergency rooms. Under Thompson's leadership, the company started using artificial intelligence to automate claim denials. This is a problem because even under human supervision and analysis of claims, if you've ever had a medical problem, unless it's very basic diagnostics, it'll be denied. And then you have to do an appeal, and then that appeal denied, and then you got to do an extended appeal. Most of the time, doctors don't actually go for the appeal, it just gets denied. And we'll go into that in a moment further. It's a for-profit company. It's traded on the New York Stock Exchange. So Brian Thompson's main goal was to increase profits, which he obviously did. And we'll go into the details on that in just a second. And the only benefit from using artificial intelligence that they designed themselves or a third party did, tailored to their needs, would be the ability to lay off employees as well as increase and accelerate the automatic denial of insurance claims for medical treatments that doctors already deem medically necessary, which is already a problem for insurance companies because they don't believe the doctor when they say a diagnostic or treatment is medically necessary. In my experience, I needed IVIG for autoimmune encephalitis. It is very common first-line therapy for autoimmune encephalitis and intravenous immunoglobulin. I had an appeal or a claim sent for it, immediately denied, immediately. Then I had an appeal, took longer, denied. Then I had an extended appeal, which took months. And it was finally approved because my doctor just shat out as much research and documentation to back that IVIG is first-line therapy for autoimmune encephalitis. And they finally accepted it, and I was given IVIG. And this is extremely detrimental for people with autoimmune encephalitis because you'll see everywhere in research on AE that fast and aggressive treatment leads to better prognosis and outcomes. And so this delay in treatment from appeal to extended appeal is dangerous to patients and can lead to death. And we'll get into that in a moment. Luigi Mangione lived in Honolulu for 6 months in 2022. He had a back injury where one of the bones in when one of his vertebrae slipped forward, which can cause all sorts of things like pain, numbness, tingling, weakness in legs, difficulty walking. He left a manifesto, very, very short. It's not like Jordan Peterson's like conservative manifesto, which is basically unreadable. I'll skim over it a little bit. He says to the feds, "I'll keep this short because I do respect what you do for our country." He says some things to basically admit what he did. Frankly, these parasites simply had it coming. A reminder, the U.S. has the #1 most expensive healthcare system in the world, yet we rank roughly number 42 in life expectancy. Obviously, the problem is more complex, but I do not have space, and frankly, I do not pretend to be the most qualified person to lay out the full argument, but many have illuminated the corruption and greed decades ago, and the problems that simply remain. It is not an issue of awareness at this point, but clearly power games at play. Evidently, I'm the first to face it with such brutal honesty. Going forward, in general, and that's just like a quick synopsis of his manifesto. It's only a few paragraphs, but I just read a few key points there. Again, I have to go kind of quick because how long are we in here? 4 minutes, so I got like 4 minutes more. For the full year of 2023, earnings from operations for United Healthcare were $22.3 billion, an increase of 13.8% from 2022, which validates that Brian Thompson was rocketing their profits. And the only way they could rocket their profits, their greatest expense outside of employees, which, if you look on Indeed, their average salary is 20, or their average income is $20 per hour. So that's not a great expense, but their largest expense is paying for insurance claims, which is why they are incentivized to deny it, not only for shareholders, because that increases the worth of their company and is favorable for shareholders, but because they're for profit. So when they deny these claims, they reserve more revenue. During 2023, the company returned $14.8 billion to shareholders $290.83 billion was accrued in revenue in 2023, the highest revenue of any publicly traded health insurance company. The projected revenue, which is probably less now for 2025, was $450 billion. United Healthcare stated and admitted that they use AI as inputs in the decision-making process and combine these with inputs from patients, providers, experts, and partners, thereby helping to mitigate risks related to fairness, accuracy, safety, consistent with our guiding principles, which to me smells like bullshit, because using AI to automatically decline insurance claims seems like an expedited way to lay off employees and to automate immediate denial of insurance claims, rather than improving the care of patients by using AI to promote increased coverage of claims. Again, considering they're a for-profit, publicly traded company. So again, $290 billion of revenue in 2023. So that's after all expenses. And the total insurance claim payout in 2023 was $54 billion. United Healthcare denies 30% of claims submitted, which is nearly double the industry average. A Senate report highlighted that United Healthcare denied requests for post-acute care, such as nursing care for patients recovering from stroke, at a rate of 22.7%, increase from 11% in 2020, which goes to show that after Brian Thompson's tenure or introduction as a CEO at United Healthcare, he increased via AI or otherwise, which he implemented and was overseeing. There was a 11% increase in denying post-acute care for patients such as those recovering from stroke. A survey conducted by the American Medical Association in 2023 found that 94% of physicians reported that prior authorizations delayed patient care. 78% of physicians said that these delays often led to abandonment of necessary treatments. So it delays care, right? So you get the appeal, then you do claims, denied, appeal, denied, extended appeal, denied, or approved. That can take months. And if this person needs acute treatment for something that is life-threatening or can cause significant sequelae, such as in my case, when I experienced many denials for insurance claims for first-line therapy for autoimmune encephalitis, that has led to delayed care, not only by the negligence and stupidity of a lot of doctors, but also these insurance companies, I now live with significant sequelae. Brian Thompson makes $10.2 million a year. Under his leadership, United Healthcare's profits increased from $12 billion in 2021 to $16 billion in 2023. Health expenditures per capita in the United States, which is the average amount of money spent on healthcare services per person, was $12,555 in 2022, which is the highest of any country in the world. And yet life expectancy in the U.S. Is 4 years below the average of 10 other first world countries. Preventable deaths, pandemic deaths, health equity, access to care, administrative efficiency, and healthcare outcomes, United States ranks the lowest out of any country in the world. Again, earlier I mentioned that they are publicly traded. This is a problem because there's a profit motive for shareholder interests. So publicly traded companies are accountable to shareholders who expect the company to maximize profits and deliver strong financial performance. The way they do this, denying claims. That's their main expense, is denying claims. So they increase, not only does the CEO get paid more, but the value of the insurance company itself rises, and it is advantageous to shareholders when they automatically deny claims, which again, they're using AI to do that, which just makes it even worse. All this to say is that Brian Thompson is responsible for tens of thousands of deaths because of insurance claims being denied or extended for people who need critical care. And one man assassinating a guy responsible for the tens of thousands of deaths of patients who needed this care that were denied it despite their high monthly premiums. I view it as somebody who basically murdered Mussolini. So it's like one death compared to tens of thousands. Now, I don't 100% condone the idea that people who don't use violence are cowards because, with plenty of movements in the past, like when Trump was elected, Me Too movement, George Floyd, Molotovs were being thrown, cars were being flipped over, businesses were being broken into, mainly by the left. Again, I'm not trying to be like super political here, but that's the truth. It was mainly by the left. I'm I'm seeing none of that with this, which doesn't make any sense to me at all. So what the assassination of Brian Thompson has done has brought into the limelight the issue with insurance in general, not just United Healthcare, although United Healthcare obviously is detestable based on their statistics and the utilization of AI to automatically deny insurance claims, and their massive attempt for gaining profit, especially after Brian Thompson became CEO of United Healthcare. But it also, for people who aren't sick, who don't have to worry about, who just do a copay for their primary care visit, for a general physical, they're not really concerned with insurance claims being denied. They're not getting treatments. They're not getting diagnostics outside of basic blood work. And what this has done is brought into the limelight the issue of insurance companies and how corrupt they are, and that we pay extremely high premiums and get denied over and over and over for necessary health care that can lead to, like I said, preventable deaths. The U.S. has the highest rate of preventable and treatable deaths for all ages, despite the highest amount of money per capita given for health expenditures. So this matters to me on a personal level because I was delayed treatment, not only because of the negligence and stupidity, frankly, of the doctors that I saw, but also because of the delay caused by insurance claim denial. And that slowed down the process because ultimately I needed chemotherapy, and that's like top of the line. That's not first treatment. But I had to get through all these treatments and try them out before I got to the chemotherapy, and the chemotherapy is cheap as hell. So I had to go through a claim after insurance claim after appeal after appeal after appeal, and that extended the amount of time I was in suffering. And as you can see on my MRI, I have atrophy in my brain. Not a lot of people know that. Not even people in my family know that. It has caused significant sequelae from the autoimmune encephalitis due to this delay in covering insurance claims for medically necessary treatment that is well documented for autoimmune encephalitis. So I'm frustrated because it's brought to the limelight the issues of insurance companies being corrupt and essentially not trusting the doctor's expertise when it comes to what is medically necessary for an individual, and has obviously, based on the statistics I've given you, led to negligent and preventable patient death. And not only that, but sometimes abandonment entirely of treatment that would have otherwise been necessary for the patient if the doctor doesn't appeal or do an extended appeal, or all of those get denied. And so I'm seeing, like, I don't know if I said it in this take, but I'm not seeing anybody in the street throwing Molotovs, tipping cars, rioting, nothing. And this is the first time that healthy people have really gotten to see some of the specifics of why insurance companies are shit and why we need healthcare reform on a massive scale. And it's just become a meme on Instagram of Luigi and healthcare sucks and all that kind of stuff. But nobody's like speaking up for the people. Nobody's rioting. This is the time to be rioting. This is the time to be flipping over cars and demanding better treatment for the American people, so we can prevent these prevent the deaths that are otherwise occurring and have occurred in the tens of thousands under the supervision of Brian Thompson. United Healthcare, one of the largest health insurance companies in the United States. I think you get my point. I'm not a fan of insurance companies. I'm not a fan of how they operate. And this completely exposes the disgusting behind-the-scenes look at what United Healthcare does for automated claim denials and how they treat their patients, and raises suspicion for many other insurance companies and what they do as far as denying claims for patients and denying necessary health care for life-saving treatments and treatments that would otherwise prevent sequelae such as in my case. Now is the time for reform, for rioting, and for the people to speak up, and I'm not seeing it, and it's driving me fucking crazy. End of rant. Have a good day.